This is Dr. Aldoori. Good morning. Today we're going to discuss one of the most common problems that is often underdiagnosed or missed by many practitioners: vitamin D deficiency. This is a global problem and a common health issue. It is quite prevalent in the United States. About more than 50% of the population are deficient in vitamin D. Also, it's very high in the elderly, obese, nursing home resident, those on certain kind of medication. Unfortunately, there is no screening program for vitamin D deficiency, so the practitioner has to put high index of suspicion in patients with many medical issues. It's quite common among elderly, obese, nursing home resident, hospitalized patient with malabsorption, patient with certain kind of medication like anticonvulsant and steroid medication are at high risk of vitamin D deficiency. The deficiency may be related to population with high melatonin in their skin. African American are at high risk. People in the Middle East and India, Pakistan, Turkey, they have a large 90% of the population. They tend to have vitamin D deficiency. The symptoms are usually asymptomatic, and it has to reach certain level before it shows the symptoms. The symptom that could relate to vitamin deficiency is bilateral lower back pain, generalized muscle aches and pain, weakness in the muscles of the thigh, depression, also increased risk of a fracture, increased risk of fall, osteoporosis. They're all associated with vitamin D deficiency. How to diagnose vitamin D deficiency? As I said before, the high index of suspicion should be kept by the practitioner. And the patient who are at risk of this should be checked and given supplement. The level that is regarded as normal is above 50 nanomole per liter, insufficient between 25 to 50, deficient is below 50. Many studies has been performed to show the effect of deficiency of vitamin D all over the world. One of the studies that has been done is the Women Health Initiative study. And this is the largest study in the world, and it's done by United States, published in year 2002. And this study was mainly aimed at hormone level and osteoporosis. And through that study, they found that vitamin D deficiency is associated with osteoporosis, increased risk of a fracture, increased risk of recurrent fall, and that vitamin D deficiency is associated with increased risk of cardiac disease like heart attacks and high blood pressure. Women below 25 nanomoles per liter have high blood pressure above 140/90. Also, it was found that there is increased risk of cancer with women that has a low level of vitamin D. Most cancers, particularly cancer of the breast and cancer of the colon. Skin elasticity and skin health is much affected by vitamin D. Also, there is risk of depression. Majority of women with depression was found to have low level of vitamin D, and improving that level will help in improving the general health. The deficiency, the American Academy of Pediatrics requested that every child should be on 400 international units between diet and supplement. Adults who are deficient should be taken normal level in adult will be 700 to 800 international units a day. That is if they are not deficient. If there is a deficiency, we'll have to have a 6,000 international units daily for 8 weeks and then recheck the blood level go back to the regular dosing supplement. Nowadays, there are capsules of 50,000 units taken weekly, and that will help a great deal in cutting down on number of tablets that people has to take. The subject is very long, and we have to make it into sessions in order to cover the whole issue. I hope this is something that was of benefit to you. Your comment is of great help to me and will be much appreciated. We'll stop here and return maybe tomorrow or another day to continue discussing vitamin D deficiency. Have a great day.